Joining us right now, though, for an update on Canada's response to the COVID-19 outbreak is Federal Health Minister Patty Hajdu. Patty, thank you for joining us this morning. We are now talking about a possible case of community spread here in Canada. So what does that change about how we're managing all of this?
Well, a community spread simply means that it's a case where we can't track it back to a case of travel, or we can't identify exactly where that person has contracted the case. And it means that we've got wider spread in the community, and that there's a potential that more people will contract the illness. It's something that we've been preparing for, obviously, as a country with ministers of health provincially, but it's obviously something that we've been working very hard to delay as well.
It's also very concerning, obviously, because we don't have the source minister. So at this point, are you considering closing schools, or at what point do we get there when crowded events start getting canceled? When does that happen, if that's going to happen?
Well, it's really important to know that the Federal Minister of Health would not be making decisions about closing schools or cancelling community events or putting people into isolation. Those are decisions that are made at the provincial and local level. We have our role at the federal level is to support the provinces and territories with some guidance, but also with practical things, making sure that we have enough personal protective equipment for nurses and doctors, making sure that we actually have communications plan that we can support the provincial communications with, extra money if in fact provinces are struggling with healthcare needs, even looking at how we resource in terms of extra people that might be needed to support communities as they go through an experience of having widespread transmission.
And for speaking of practical, we're talking about people's lives. We are seeing a lot of people rushing out to buy things like toilet paper. People are talking about that. Bottled water is another thing people seem to be purchasing at this point. Should Canadians be stocking up on supplies right now?
Well, as I said last week, it's wise to be prepared that for any kind of adverse event in our lives. And of course, this is not a new message. It's one that often gets ignored, but things happen in our lives, whether it's a disruption in terms of weather events, or in this case, having an illness or having to take care of someone who's ill. So, when you're out grocery shopping, you can pick up a few extra things. Certainly, there are things that you'll need and things that you won't need. I mean, bottled water, we don't anticipate that there would be a stopping of running water. This is really about just knowing that you might be, if you contract the illness, not able to go out and get your own groceries. Or if you're taking care of someone who's sick, you may be placed in isolation as well, so that we prevent the spread of disease. Ultimately, that's going to be the goal of public health officials, is to really limit how much this disease does spread through our communities, and we're going to need everybody to work with us to do that.
I want to talk about the cruise ship that's off the coast of San Francisco. There are 235 Canadians on that ship right now. The presumptive case in Alberta is a woman who was on that ship. Can you update us on what's happening with the Canadians on board?
Well, we're still working with the American authorities to determine the health of the Canadians on board, and we'll be collaborating closely with them. I spoke with Secretary Azar a couple days ago, and we have a very good relationship. And as we work through the details about how they'll be testing individuals and what the status of the health concerns of the Canadians are, we'll be putting into place resources to support those Canadians.
And do you have any more information on the status of anybody on the ship at this point?
I don't. My most recent understanding is that they're still underway testing individuals to determine if they have the virus, and that's an important step that has to occur first.
Minister Hajdu, we appreciate your time. Thank you.
Thank you so much, Lindsey.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.